Hi, and thank you so much for joining me. My name is Dr. Megan, and I am a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And I like to take an evidence-based approach to health and wellness, particularly in the realm of lifestyle medicine, weight, and obesity medicine. So thank you so much for joining me today. I am making videos again. The pandemic has kept me very busy, but I am so delighted to be back here making videos. And let's talk today about things to consider before you start an anti-obesity medication. First of all, there are a lot of great options for somebody who is looking to start one of these medications. And just as a caveat, when we're talking about weight medications, like it is always the patient's choice with regards to whether they start one or not. Somebody might have a BMI that is on the higher range in terms of if they fall into the obesity category or not. And it's always their choice with regards to whether they start one or they don't start one. You never have to start one, and it's always completely up to you as a patient. But for those patients who are interested in lowering their BMI, this video is for you. So things to consider before starting weight loss medication. There are a variety of medications that are FDA approved. And first thing to consider is type of medication you are thinking of trying with regards to oral medication or injection medication. Now, I do have a lot of patients who, when I talk about injection medications, they get very scared and they really don't want to be futzing around with needles, or I think they have very scary visualizations of what that looks like at home. But I will say that the medications that are injection medications actually work better and they're really easy to use. So that's just something to take into consideration that if you are scared of needles, you hate needles, it's probably not as bad as you think, and definitely worth at least hearing about and watching some videos of the medications on their website, how to use them, because they usually are quite user friendly. The second thing to consider when you are thinking of starting a medication to help lower your BMI is that these medications are lifelong. Do not listen to somebody who tells you you can go on and then off these medications. You can go off of them, but they won't work anymore. They don't have this sort of prolonged effect. It's not like an antibiotic where you take it, you get rid of the infection, and then you don't take it again. No, for weight loss, these are lifelong medications. If people have side effects, certainly we have to change the dose or we have to change medications. But the goal is that when you start a medication for weight loss, it is quite preventive in a way because you're stopping people from developing complications of a higher BMI later in life. So the goal is that they could lower their BMI and maybe go off of their blood pressure medication, or lower their BMI and maybe their cholesterol gets a little bit better, or lower their BMI and their liver enzymes look a lot better. So while it is adding something to their medication, we are always having the goal of kind of simplifying their medication routine or simplifying medical issues that they have to deal with in the future, and ideally preventing those from happening. The next thing to think about for people who want to start a medication to lower their BMI is to do their homework, because you really want to take charge of this journey, for lack of a better word, because there's a lot of moving parts, especially because many of these medications are not generic. So you definitely want to reach out to your insurance company, see what they cover, see what they don't cover. Maybe there's extra paperwork that needs to be done by your physician. Would you have to pay out of pocket? What would that cost you? And what are the potential alternatives that might be just as good, but easier on the wallet? Another thing to think about is that starting a medication to help with weight loss doesn't mean that we stop any of the lifestyle changes that we've started. So it's not one or the other, it's both, because the medications definitely work better. You get a better effect if you are eating the way you want to eat, sleeping the amount that you want to sleep, if you are exercising the way you want to exercise. Like when all those other things are lined up and they're where you want them to be, then you're going to get a much better effect out of whichever choice you go with. And sometimes I do think that starting a medication first kind of helps people with the momentum of weight loss. Sometimes for some people, it's easier to start the workout or change how they're eating or what they're eating when they can see progress. And so sometimes for those people, I'll think about starting the medication first and then really working on the lifestyle changes and seeing how far we get with them. Some people are, it's kind of the opposite. They've kind of done all these things, they've made all the changes, and they're just not losing weight. And so then the medication is a very useful tool to help lower their BMI, even though they've made all these great lifestyle changes. So it's not either or, it's both. They definitely work best together. You're going to get a much better effect out of your medication if you are making or you've already made the lifestyle changes that you want to make. Another thing to think about is to be patient, because we want to make sure that you are getting the full effect from your weight loss medication before potentially adding something else, because some of these medications can work very well together, especially some of the oral medications and the injection medications. They can be combined depending on the patient. However, some of these medications, you can continue to lose weight, especially like semaglutide. Somebody who maxes out on the top dose of Wegovy, the weight that they are at when they start the 2.4 milligram dose isn't necessarily the weight that they're going to be in 3 months afterwards. They can continue to lose weight after they hit that maximum dose. So you just want to let the medications work and just be patient so you're seeing the full effect, so you have the correct data in terms of the next steps forward, because this really is a lifelong process. And the last thing you want to do is to change a lot of things at once, then something, maybe somebody has a side effect and then you're not really sure what caused it. So it's not, you don't want to hurry the process, even though people, if they're looking to lose weight, I think there's always a tendency we all want to get to where we want to be as fast as possible. But in this case, it really does benefit you as the patient to just have the long view in mind. The last thing to think about is some of these medications may not be a great fit for you. So there are a variety of medications now that are FDA approved for weight loss. And depending on the comorbidities that somebody has, high blood pressure that's not well controlled, tachycardia or heart arrhythmias, glaucoma, kidney stones, some of these conditions can mean that all the medications might not be the great fit. And that's why we have a good variety now. Decades ago, we didn't really have that much available, but in the last few years, there have been a lot of very exciting developments and very exciting things in the pipeline that will be brought to market at some point in the near future. So there are many options available, but not every option may be available. I'm going to leave a list of the current FDA approved weight loss medications in the notes below. And these are always subject to change. And also there are medications that are used off-label for weight loss as well. And that's definitely worth a conversation with your physician to make sure you have the best picture about what's available. But I will leave that down below and can definitely do more of a deep dive into some or all of these medications if you guys would like that. So that's going to do it for today. And thank you so much for watching, and please be well.